Well, to help us sort out through all the latest developments on the vaccine front, let me turn to Dr. Alok Patel. He's a pediatric doctor and medical journalist in San Francisco. Dr. Patel, you and I have talked about vaccines for some time now, but before I get to what's happening on the vaccine front, I want to talk about what's happening at the White House with this vaccine summit. What do you want to see come out of this gathering?
Asiya, it's good to see you. What I would want to see, what I hope everybody does see, is transparency, evidence and science being pushed first, and a very clear-cut plan to the American people about when we can expect to see a rollout of the vaccine and how it's going to be distributed. I don't think this is the time for politics, and so I side with everyone who's concerned about that being placed ahead of evidence. I hope we just stick to very transparent information because we have to build trust with the American people about the safety and efficacy of the vaccine.
Science is clearly critical here. How can you really build trust from what comes out of the White House when Anthony Fauci, Moderna, Pfizer, the makers of some of these vaccines, basically are not there?
And I think on the surface, that does raise a little bit of a concern, and people out there are wondering, well, is this already doomed to be a political event? And I think all that means now is that the ball is in the White House's court to take this summit in a responsible direction. They are going to be the main communicators right now about all these questions about what happened with the Pfizer purchase over the summer, what can we expect of the FDA review on December 10th, which is only in a couple days, and what is going to happen with the widespread rollout. What is everything going to look like? And I think this is even more responsibility now on White House communicators now that those CEOs and Dr. Fauci will not be. Huge responsibility.
Does the administration's Operation Warp Speed that President Trump has touted over and over again, basically taking credit for the speedy development of these vaccines, do they in fact deserve some credit?
Asiya, I think it remains to be seen. I will outright say that from what I've read, there is some credit where it's due in terms of getting the funding and getting the priority in terms of manufacturing. And it'll be interesting to see how this all plays out. And I hope that credit goes where it's deserved. The one thing that does concern me, however, is all these terms about warp speed and racing to get a vaccine are concerning some people that corners have been cut with respect to safety and quality, when in reality, that's not true. You know, there have been some areas where things have been sped up because of manufacturing technology and this kind of global collaboration towards getting a vaccine, but that has not at all undermined safety of getting the vaccine. But some people hear warp speed and they think that, you know, the vaccine may have been rushed. And so I think that needs to be addressed as well.
Let's move on to the UK as it began the rollout of the Pfizer vaccine. Dr. Patel, is this a game changer?
It's absolutely a game changer, Asiya. You know, we're already looking through the data right now, the briefing document for the FDA. I've been reviewing it. It's like 92 pages long. I've been doing my best to run through it, and the safety data looks great. We're seeing this roll out in the UK, which is a great sign because they already reviewed the data ahead of our FDA. Now, this is just step one in terms of getting people vaccinated who are at higher risk of catching or spreading COVID-19, possibly getting severe complications, which is why we saw the UK prioritizing people, elderly people, people working in nursing facilities or healthcare workers. But all in all, this is the first step towards getting us towards that herd immunity, that 60 to 70% vaccination rate where we can finally kick this pandemic to the curb.
Okay, so here's a question for you. Are you going to get vaccinated?
Absolutely. I'll be first in line as a healthcare worker. All you can do it on live television.
And what are you going to tell all those skeptical people who say, no way, this developed way too quickly, we're not going to do it?
Well, the first thing I'm going to tell anyone like that is I understand why they're getting questions. We need to talk about how the science and the technology has been vetted far before Operation Warp Speed, and people just need to see that transparent data about all the trials between Pfizer, Moderna, and any other vaccines that come out, and clearly see how the safety profile has been made and why we are so reassured that the vaccine is not only safe, but it works. And I think when healthcare professionals and people out there with a platform actually share the same message, that'll help build trust amongst not only the American people, but everyone worldwide.